Shahid Latif. Today I am sitting in for Zafar Haq, who unfortunately could not make it today. So you are going to have to put up with me today. But hey, we've got a wonderful topic. And when I say wonderful topic, an extremely topical topic, which won't be a stranger to any of us. But we've got some lovely guests, some experts on who are going to give us an update on COVID. And this is something that we've been talking about since the last couple of years. It's been 2 years or a little above 2 years, and we've come a long way. And I think, having said that, it hasn't completely gone away. And we have now got an opportunity of a couple of experts who are going to be talking to us. Now, before we do that, just want to remind our listeners that we want you to join in and we want you to ask questions. And there's various ways you can do that. As you would know, you can see us online, that's ramadan.fm, or on radio on 87.7, or you can call us on the studio number, which is 0116 482 2086. That's 0116 482 2086. Or if you don't want to talk to us, then you can send us a text message on 07748 855 055. That's 07748 855 055. We are on live streaming on Facebook and also on YouTube as well. So if anyone's listening to me right now live, call in. If you are not, you are listening to a recorded version of this, and please listen because we've got some excellent guests coming on. So I'm just going to introduce our first guest because we are just still awaiting for our second guest to come into the studio. So we've got Leah Chilingwe, who is a health equalities and project lead for the COVID vaccination program in LLR. I will introduce my second guest when he arrives, but I'm going to go straight into saying welcome. Thank you very much to Leah for joining in this evening.
Thank you. Thank you for having me. Thank you for having me.
It's our pleasure, Leah. It is our pleasure. And we are going to be learning a lot from you today. And we obviously are very keen to understand where we stand and where we are at this current time in relation to COVID and COVID vaccinations. And being Ramadan Radio, as you know, it is a radio station which is run by Muslims, and I'm sure there's a lot of work done within the Muslim community. I was forwarded a link today, which is a wonderful link, initiated by the council, etc., giving information. But what I'm going to do is I could speak for England, but I'm gonna be quiet and I'm gonna go to Leah. So, Leah, first question: is COVID still a concern for all of us?
Absolutely. And we were just talking today that when you see, even though we work in health, the world seems to have moved on, but health really hasn't. When you look at the hospital rates, admission rates, they're still increasing with numbers of people who are being hospitalized with COVID. The rates of late in the last 2 weeks are really increasing. And in Leicester in particular, there is a steeper climb. Even though the numbers were lower, what we're seeing now is more a steeper rise in the numbers of COVID. So yes, I think what we're seeing is we think that the officially the direction to have social distancing or no masks has gone, but the truth is COVID is really real, and it's not something that we can ignore, because in health we can see the effects of the disease.
Absolutely, yeah, very well said, Leah, and I couldn't agree with you more. Excuse me, that we are beyond where we were before, but very much the virus is out there, and as we are aware, people are still getting infected, though to the lesser degree in relation to severity, but the virus is very much out there. So absolutely agree with you. And do you think, despite the government having said that the guidelines or the safeguards which we should be following, for example, what you've highlighted, the masks and the washing of the hands and the distancing, etc., how important do you think these still are, Leah?
I would only use my own personal example. For example, I went to London for the first time in 2 years, and I was in the underground, and there wasn't any social distancing, and of course physically you could see that this was not a place where you would leave unscathed. And the truth is, even though that we look at it, when you look at the numbers that are going higher, there are people who've been through the same situation I was in, who are not masked, who don't, you couldn't social distance in the tube, but you do the best that you can. So I just believe that we need to, on a personal level, still be absolutely careful in the way that we use those rules. Just because they're not mandated didn't mean they were not useful. And if you look at the numbers of people who are hospitalized, yes, we're so much better, we're so much far, severity is still lower. But do you want to take the chance and be that percentage that is really affected negatively in this climate? And I think that if you're looking at your loved ones, my answer would be no. So yes, the masks are not there, but I think on a personal level we need to take that action. We need to make sure that we follow the rules even for ourselves. Just because nobody's telling us to do it, we know that it works for us. So I would encourage people to still, if they can, social distance, wear the masks, sanitize their hands, all the good and wonderful things. And I'd be remiss to say, and get vaccinated.
Absolutely. We will come to vaccinations in a moment.
Mm.
And you're absolutely right, Leah. I mean, number one, there's no harm in washing one's hands regularly. It's part of hygiene anyway, isn't it?
Yeah.
And using sanitizing cream or lotion, as our producer is at the moment, as we're speaking. But yes, I mean, during Ramadan especially, we do have more congregations in mosques, especially in the evening, something which we call Taraweeh prayers. Which it's not an obligatory, but people go by choice, but do go, and it is large numbers and masses, and it only makes sense, doesn't it, that it is a perfect breeding ground for viruses, isn't it, where you have large numbers where people are very close together, and it's solely sensible that people who do wear masks.
Yeah, I would be saying so. And I think I always challenge people to say, we saw the proof of the devastation that the virus had on us, just maybe 2 years ago, 18 months ago. And the proof was there for all of us to see. And just because the rule has been removed in terms of being mandated, would I then take away the rule as well for my application, for my own life, or for the safety of my loved ones and friends and family? And I would encourage, very, very gently but strongly, it doesn't hurt you. It didn't hurt us to wear masks. It didn't hurt us to sanitize. So why would we stop now?
Absolutely. I couldn't agree more with you, Leah. Leah, I also want to ask you just a follow-up question. Now, what do we know at this current time about the latest levels of infections? I'm talking specifically about Leicester or Leicestershire.
Leicester's rising, City in particular is higher. And I think that the data that we're getting is potentially not accurate. But when you look at it in comparison, when you see the graphs, we look at graphs and numbers, you can see it rising. And it was in this week's data, actually, you can see a steep when you look at the way the curve of the graph is going. So the numbers are rising. And I think that we may not see it because we don't have the mandated actions in the community, but the numbers are rising, and the numbers are rising in terms of those who are being admitted in hospital with the disease. They're arguably lower, but they're still there. And the question I always ask people is, even if it's a low number, say you're talking about 13%, do you want to be the 13% hospitalized with COVID, is the question I ask.
Absolutely. Should we be worried, Leah?
Um, I think we should never stop. We should have never stopped worrying, But I think that the only thing that we have is, for me, I've seen that the intensity of it has reduced because we've got, really good rates in terms of vaccinations. So I don't think it's something that we should have stopped worrying. It never stopped. It never went away. But in terms of where we are today, I'd be saying we're in a better chance than we were 2 years ago when we didn't have a vaccine.
Absolutely. I've seen lots of cases working in a hospital myself, and I include myself in that as well. We've seen a lot of cases where individuals, colleagues, professionals have developed flu-like symptoms, but they haven't tested positive. So while we are talking about COVID, we're getting very similar symptoms from the normal flu as well. What it seems actually is that the normal flu symptoms are very much mimicking from a level of degrees perspective of what COVID is like. And I just think that irrespective of COVID, because of that very much case, what you said earlier on is that we still should remain very cautious in relation to making sure that safeguards are there, that we should still maintain that very much so, because even the flu itself, the severity, is that something you've seen in your experience as well?
Yes, so in terms of the work that I do, I'm now trying to look at what does it mean for flu in terms of supporting that vaccination program. And what we've seen before, I think flu was quite a difficult disease to actually. It was quite challenging, I think, for people, especially people who are elderly, and so I think as a community we thought it doesn't really touch me. It's really just for the older people, the liech languages. But I just think that that now we're quite in a different space, and I think that all of us who are susceptible to COVID potentially have got that risk to flu. So what you're saying is absolutely right. I've got people who I know who've had flu-like symptoms, but haven't really tested positive for COVID, but the severity of what they're feeling is still higher. So I would be saying we need to start looking at flu as well,
Absolutely, Leah. Absolutely. Leah, and listeners, I'm pleased to say that we've got Dr. Raj Tan, who's just arrived in the studio. And I just want to introduce Dr. Raj Tan. He's a GP and a CCG board member for LLR and CCG. So, Dr. Tan, Dr. Raj, how would you like to be addressed? Welcome.
Thank you. I'm sorry that I was going to be late. A bit of a 5 minutes.
No, thank you very much. Thank you for joining in on a working day, an evening, and making the effort to come in and talk about a very important topic.
Yeah.
We have touched on a few things, Dr. Tan, and it's obviously in relation to COVID, and Leah has very succinctly articulated what is a very sensible approach and the way to take things. And I just want to ask you sort of this on the same tone, questions specifically before we kick off and go into other areas, is that do you feel, in your view as a GP, do you think COVID is still a concern for us?
I do, actually. I don't think COVID has gone away yet. And then the cases are still there, and then it's not going down significantly. And the spread is still happening, and then we still need to be very careful about this. Yes.
And as a GP, Dr. Tan, are you still seeing quite a number of cases?
To be honest, day in, day out, we do see a lot of patients still getting COVID tests positive, and some are with symptoms, some are without symptoms. But yes, most of the patients are getting mild symptoms. Yeah, but that doesn't have to say that there are no patients without any severe symptoms. Yeah, there's less than before when they compare to the other variants of the COVID, but still we're getting quite few patients calling every day. Yeah.
Excellent. And in relation to the safeguards which the government had put in place a couple of years ago, which now obviously they said you don't have to do, it's not mandatory anymore, specifically talking about things like masks and also talking about hand washing, sanitizing, etc., keeping that distance. What do you think? Leah has said there needs to be a sensible approach, and we need to make a judgment, a sound judgment in relation to where we are, especially when we're in large masses. Would you feel that should be the case?
I totally agree with you. I think what COVID has taught us is to be sensible and to be like judging what we are doing day to day and looking after us, actually more than before. And although like government is not putting these measures as mandatory, it will be you have to decide it very sensibly. And if you are going into the places where you're crowded, and depending on your condition as well, you should use the masks. And then definitely the other hygiene, like hand washing, I think we all should do it, whether anyone says it or not. That is and then making sure that your house is well ventilated, keeping the doors and keep the windows open when you can. And I know that weather's getting slightly better now again, and so that will help.
Yes.
And making sure that you keep yourself healthy as well, and then take the vaccines. That's the most important thing.
Most important thing, absolutely. Yeah. We will be talking about vaccines later on a little bit in the show. I just want to remind our listeners that please do call in, because your participation and your questions are really, really important, because that's what our experts have taken out the time not only to give their views, but also answer any questions that you may have in relation to COVID, in relation to the vaccine, etc., or any other questions in relation to the virus itself and how it overlaps. And, we've already briefly touched on the normal flu, influenza, and how they mimic one another and what to do in those situations. So in order to do that, I mean, you can come on to, listen to, as you are at the moment, Ramadan.fm, or give us a call in the studio on 0116 482 2086. That's 0116 482 2086, or send us a message or WhatsApp message on 077 488 55055. That's 077 488 55055. And we are live streaming on Facebook and YouTube. So feel free to come in and join in and be part of the discussion. Just staying with yourself, Dr. Tan, for the moment, being a sort of a medical, and we can ask Leah to contribute to the next question as well. So a lot of people are still asking, especially with where we are at the moment, and they're still asking questions. What are the symptoms I should look out for? I mean, these are questions which we've asked. Yeah. And is it just about losing your sense of taste or your sense of smell, or is it more than that?
That's a good question. I think the symptoms of the COVID, as it evolved now, has grown into a lot more wider symptoms. Yeah, although we are well known as the loss of taste and loss of smell as one of the COVID symptoms, there are actually quite a lot of overlap, like you said, with the other viral symptoms, like feeling lethargic, and then you will feel aches and pains of the body. Yeah, it might get sore throat. Yeah, it might get a bit of a fever and cough. Yeah, it might get runny nose with it. And all those are actually can be COVID as well, although it can be other viruses like influenza or flu can cause these as well. So that's why it is very difficult to ignore those symptoms as the other viral symptoms. And if you get those, although there's overlap, you should get tested. Yeah.
Excellent. Thank you very much. Leah, is there anything you would like to add to that?
No. I think the good doctor has just given everything that we need to know. I'm busy ticking and thinking, have I missed anything for myself? But no, actually, that's good.
Excellent, yeah. Excellent. And just a follow-up question to that, if I may, Dr. Tan. Yeah. When should someone be worried? What are the severe symptoms when people, because I suppose this is really important, isn't it? Because it's like an influenza, isn't it? Yeah. But nobody goes to the GP or to the A&E if they've got flu-like symptoms. Mm-hmm. But when should people start getting worried, and when should they start contacting their GP or go to the A&E?
Yeah. First of all, it's about your own health as well, underlying health conditions. So people who are supposing diabetic and who are on the medication for immunosuppressions, people who have got other chronic respiratory diseases, chronic lung diseases, and those patients, if you get any of those symptoms, they need to be cautious about monitoring themselves. That's the first thing. Yeah, any of those symptoms. Although most of their symptoms may be self-limiting and maybe get better, things to look out for is especially starting with the breathing problems. Yeah, if you're getting short of breath more than usual on exertion or when you're at rest in that way, and that you should be contacting the doctor to talk about. And also if you're getting any temperature which is spiking more than few days, and you've not been able to control with the normal drug, normal paracetamol and ibuprofen, and the temperature is still spiking, should be speaking to doctor about it. And the other symptom that you can get is more of a breathing related, but if you can get swelling in your legs, or if it's getting a bit more difficult to hydrate yourself, you can't keep the fluids down, difficult to pass urine, or passing less urine than usual. Yeah, all these symptoms will be a bit of alarming to the doctor if you explain those symptoms.
Okay, so there's a lot now, isn't it, that's known about these symptoms than was even about a year ago. Right. So that's I think that's really helpful, and I think we've got a comment from one of our listeners who's written in. So I'm just going to read it out. So 40 plus and triple jabbed and not had COVID throughout the pandemic till now. Why and how long is a person contagious once they have the virus? Also, with this current surge, should vulnerable people shield again? Is that something you want to have a go at, Dr. Tan?
Yes. So the first question is about why and now. Why and now, how long is a person contagious once they have the virus? That's the difficult is they're contagious as soon as you got the virus. Yeah, and they can be contagious until 7 days, and that's why like the isolation period is 4 actually. Yeah, in that way, and the from the sim and if you're symptomatic, definitely you're still contagious as well. Yeah, and with the current surge, should the vulnerable people shield again? That's a good question. And the main thing about shielding that came in initially was 2 reasons. I think the most important reason being we were not sure of this virus like in fully, like what kind of virus and how to do with it and how to deal with it and all those things is one thing. And the other thing also is like the severity and potency, like the virulence of this virus, we call it. Yeah, was the different strains of this virus causing different symptoms. So those factors decide in like whether we start the shielding at that point. Although it is the virus is at the surge again with this another strain with the Omicron, and the strain is surging. We know that this virus is less virulent, yeah, but it's more contagious than others. Yeah. So people who has got these kind of underlying conditions will still get will get this virus, and then the practicalities of shielding will be what is like a main issue in here. If you got severe like those kind of vulnerabilities in that way, I will certainly limit, like at least not to the shielding stage, but at least limit that not to go out in a very crowded places. And if you go out to anywhere like that, wearing masks, yeah, making sure that you wash your hands, making sure that your house is ventilated, all these measures, and making sure that you get vaccinations. Yeah, if these measures will be more important than completely shielding at the moment, but depending on your individual circumstances as well. Yeah.
Excellent. No, that's you've actually answered my next question as well, which is the extra precautions that people can take. And I'll just go to Leah now, whether Leah wants to add anything to what you've already said.
No, I think as well as a program, what we're doing is being very mindful of people who are vulnerable and ensuring that they've got access to vaccines as well. So I think that the history of why they were shielding, I think Dr. Tan has explained. So I would be saying is that sensible approach that he's already touched on in terms of making sure that we're not going into big crowds. We're following all the rules that we did in the last 2 years. So yeah. I think it's that, isn't it?
Yes, absolutely. And just staying with you, Leah, for the moment. Another question, which I suppose it's be important for our listeners to be aware of, is vaccination still being offered in LLR?
Vaccination is still being offered to everyone who requires a vaccine in LLR, and that's part of my role to try and make sure that we put vaccine in places where people need it. So if you've never ever been vaccinated, we can vaccinate you in LLR. And it's so long as you're 6 months from your last vaccine, we will vaccinate you. So there is an opportunity there, and there are places and links. The website will show you, and there's just different ways in which we're trying to carve out vaccine availability to the communities across LLR. And my part of my job is to ensure that we break down those barriers and ensure that we get vaccine into the arms of people that actually need it.
Absolutely. And Leah, I'll come to Dr. Tan next, asking the same question. What are the benefits of getting a vaccine?
If I look at my personal self, and I'll talk. Dr. Tan can talk from a medical kind of angle.
Yes.
As a BAME woman, I think we've just heard about how it's really important for us to get it. I got COVID the first wave, and I was hospitalized the first wave, and then I got COVID after I got boosted as well. And the intensity of that was, I felt it personally in my own personal journey. How I felt the first time round is definitely not how I felt the second time round, and I definitely wasn't hospitalized. So if you just take away my own journey and in terms of a personal one, not the stuff that we are telling you from a program perspective, I'd be saying that you're actually reducing the chances of yourself being hospitalized or even potential death. We've seen people die from COVID. So yeah, I couldn't emphasize it more from my own personal journey and from being an expert on the program.
There's nothing more powerful than personal experience, is there, Leah? And you've been there, and we've experienced it. So you've been the before and after. So you've had it twice. So definitely, COVID vaccine definitely.
And I do mask up. I do. So it's not, I was quite sensible. I don't know where I got it from. I blame my children, but it is definitely very different.
Yes.
Very different.
Yeah. No, thank you, Leah. That's really helpful, and I think quite powerful as well. Dr. Tan, from your perspective as a GP, I mean, what do you say to your patients? Number one, in relation to the vaccination, and I'm sure lots of patients do ask you, doctor, should I, shouldn't I? Doctor, some patients are still at zero, aren't they, point in relation to vaccine, while others decided after the first, second, they don't want the booster, etc. What would you say to our listeners out there in relation to taking it, and why, and what are the benefits?
Yeah, I'll probably ask the question again is why you shouldn't take the vaccine at all, because the why you should take is probably one of the straightforward answer that you should take the vaccine if you can. Yeah, if you can, then you should. The vaccine is not only for about, yes, we got now, as the time has gone on and research has gone on, we now know a lot about the vaccine. Yeah, and then it's evidence becoming clearer and clearer about effectiveness, not only to prevent yourself from getting serious illness due to COVID infections, but also it reduces the transmission from you to others as well. So that it's from your benefit, from your near and dear's benefit as well, that you should take the vaccine.
Excellent. Thank you very much. And I think that's a very nice way to put it, that you turn it around and say why you shouldn't.
Yeah.
And obviously, that's a big question for those who decide not to take it.
Yeah.
Obviously, something for them to think about. Leah, can people still get vaccinated now, even though they may have, been offered it before? Can they start from scratch now?
You can start from scratch now. And what we're doing as well is we're not just looking in terms of the big, at the beginning, we were looking at different sites where you could go and visit. But what I'm doing as a program now is we're trying to get the vaccine into communities. So we're doing a lot of roving, we've got a bus that goes around the city and county and county as well. So we try and look at the map, and then we just plot ourselves. We're also trying to do another bus just to make it available for 5 to 11. So we'll try and plot that as well around school areas, and then we'll try and tell the community we're here. So we're trying to make sure that we make it as easy as possible for everybody. And if you turn up at that bus, we're not going to ask you, are you eligible? Whether it's your first, second, third, or fourth, we will vaccinate you if you want to get vaccinated. We've got pop-ups in High Cross, for example, that's a stagnant one that we keep going to. We've got the drive-through, if you don't want to leave your car. So we're trying to make sure that we develop ways in which we make it as easy as possible for people to access the vaccine. So yes, if you want to get no judgment, whether it's your first one, you can get vaccinated if you decide you want to have one.
Absolutely. And just thank you, Leah. And just to follow on, Leah did give her own example or own lived example in relation to her getting vaccinated and the symptoms. But in your experience as a GP, Dr. Tan, have treatments to serious COVID disease improved since the first wave, do you think?
I do think, yes, fortunately, and I think it is a good news that we now have more treatment modalities than before to manage the serious COVID-19 infection in the hospital settings. And but that's not to say that we can cure this yet, or we can completely cure this with 100% recovery rate. But yes, definitely there are more treatment modalities than before to treat the COVID in the hospital settings. Yeah.
Excellent. I just want to remind our listeners that you can join in on Ramadan.fm. We're on 87.7, and you can call in on 0116 4822 086. That's 0116 4822 086, or text us if you don't want to talk. Some of us prefer maybe to write in, as some, as we have had it. The number is 077 488 055. That's 077 488 5505, and we are live streaming on YouTube and Facebook. Next question, I suppose, is for both of you. So maybe we can start with Dr. Tan, and that is, I know you probably get this question multiple times. Is there any forbidden contents in the vaccine?
Yes, I do get this question quite a lot by the patients, and so as we all know that there's clearly on the NHS England website and also in the individual vaccine websites and the MHRA, which is a Medicine Health Regulatory Agency websites, you can look at for all 3 vaccines ingredients, and then we've been clear that there's no forbidden ingredients in there. There are no no live tissues in there, and there's no eggs, and then no like protein materials, and no antibiotics, no additive and preservatives. Yeah, so it's actually the antigen of the virus to promote your immune system.
Okay, okay, and same question to yourself, Leah. I'm sure in your role as a lead for COVID vaccination programs, do you get this question from from the population, from people from different backgrounds?
Yes, we do. But I think what I've done successfully is I think it's always easier when you hear it for somebody that you trust. So what we've got is trusted voices. So a lot of people will trust their own GP. So when Dr. Tan has just kind of outlined it, it carries more weight than when Leah, who's in the program lead, who's trying to encourage people to get vaccination, is really, and I fully understand it, because as an individual myself, you want to have a trusted voice. So we do have trusted voices, and I think he's just kind of outlined that the vaccine is safe and what the reasons are. So we do get those questions, and what we've done successfully is just make sure that we get the trusted voice speaking up.
Excellent. Okay, that's really helpful. The next question I suppose I want to ask is, we live in Leicestershire, and we get, it's a varied population, and from different ethnic backgrounds. We've got Hindus, Sikhs, Muslims, Christians, Jewish. We have Asians. We have Afro-Caribbeans. We have whites, etc. here, and obviously all from a different. So it can't get any more multicultural than that, can it? Yeah. For the sake of our listeners, and majority of our listeners, not all, but majority of our listeners are Muslim. Mm-hmm. And Dr. Tan, maybe I can ask you this question first. Yeah. Is there any guidance that you are aware of for Muslims about having the vaccine during Ramadan?
Yes, actually, we're proud to be in Leicester with a multicultural city, to be honest. And I do have many patients which are from different backgrounds, and also a lot of patients with Muslim background as well. So, yes, there are loads of guidance now that on NHS England website, NHS website has done for vaccination during Ramadan. Yeah, which clearly it states, and then it's actually endorsed by the British Muslim Associations and other like Islamic associations for that as well. So it's clearly like urging patients to take vaccine during the Ramadan period, because it doesn't interfere or doesn't actually contradict with Ramadan religious purposes at all. And it's not a nutritional supplement at all in that. Yeah,
absolutely. And I think one of the fears that Muslims may have is that it might break their fast.
Yeah.
Leah, in your experience, do you get lots of questions in relation to that, and what would your response be?
We do. So what we've also got, I think, just to add on to what Dr. Tan has said, there is a toolkit, and it's called Vaccination Uptake During Ramadan. Yeah. So every question that any Muslim would be having at this time, religious time of fasting, is answered in there. So we've really gone in, and we've got, it's supported by the Muslim Society. So I think that is quite important. People have actually, we've actually recognized that those questions keep coming, and rather than just answering people who come to us, there is a toolkit that's on their website. It's called the Ramadan Toolkit for 2022. Yeah. So if people are looking for that, I'm happy to kind of share it, but it's something that you can Google and download, and all the questions and answers are there in that document.
Thanks.
That would be brilliant. Thanks, and I'm sure our producer will be able to share that on our Facebook group and sorry, Dr.
That's
Tan.
also on our CCG website as well, about the various very, very detailed information about vaccination during Ramadan.
Okay, excellent. No, that's really helpful. Resources are very important. I'm aware. I am aware, being a doctor and a Muslim and practicing Muslim, that leading scholars and the British Islamic Medical Association has actually said exactly what you're both saying. Yeah. excuse me, and that is that here we are. I think we have something on the screen. Absolutely, yes. Thank you. Which it's and it's on the NHS site, and which actually states that it is safe, and it does not break your fast to get the vaccine if you're fasting.
Yes.
So it's okay. I suppose the hesitancy people would have is, number one, whether it would break their fast, and number two, I suppose, would be, and I'm sure this is the questions or the concerns or the worries our listeners out there or people out there may have, is that if they get the vaccine, they may get the side effects of the vaccine, which is itself flu-like symptoms, and whether they'll be able to fast or not. So obviously those are concerns. But I'm sure in both of your roles, you do provide what we call education in relation to that and what they need to do. So any comments on that, Dr. Tan?
Yes. So yes, you're right that there is you can get mild side effects of the vaccine, especially feeling like flu-like symptoms. But those symptoms are nothing compared to getting actual COVID infection, and when you are not taking the vaccine. So if you look, and you'll be more confident in yourself, as well, if you got vaccine and if you got properly protected, than to do those religious activities and then visiting others people as well, that you are actually not then transmitting, less chances of transmitting to others as well.
Absolutely.
So there are a lot more benefits than actually compared to what you might get as mild side effects.
Absolutely. And we did touch on, because during Ramadan, Dr. Tan, and we were discussing this earlier on with Leah, and we were saying that during Ramadan, Muslims do congregate, especially in mosques and especially in the evening prayers, where you may have hundreds in one enclosed room. And I am aware that mosques do take precautions in relation to making sure cross ventilation is there. But I hardly see anyone wearing masks, and so I think precaution is really important, isn't it?
Yes, that's right. Yeah.
Okay, Leah, same question to yourself. So, what do you get these questions, and how do you challenge some, especially the post-vaccination side effects? Do you get these questions from the general population?
We do, but I think Dr. Tan has touched on that in terms of which side effect do you want to choose, the one from the vaccine or the one from the COVID illness itself. So I think that there is a lot of questions, and what we've tried to do on the CCG website as well is just do a lot of frequently asked questions and answer and myth bust as well, This will happen to me. And we're using not our own experience, but actually trusted voices and experts, people who can endorse it, especially like Muslim scholars, Muslim leaders, who will say, yes, actually what the science is saying is true. So we're trying to collate all those questions and trying to make sure that one question that comes in through my inbox, I'll make that a general kind of response, so that person is just not one person. That person might be representing, by a factor of 10, for example. I've just made that figure up. But I think we're trying to make sure that we just get that information out there. If there's even just that little doubt, we will tackle it if it reaches our inbox.
Excellent. Thank you, Leah. We're in our last 6 odd minutes, and listeners still have an opportunity to call in if they have any questions. Our number, as we've already said, is 01164822086, or text us on 0774885555. So we've still got some time if you want to ask any questions to our experts and our guests who have taken that time to talk to us about the very virus that is still out there, namely COVID, which has become a household name for us for the last couple of years. So the opportunity is still there. Yes,
Can I just take this opportunity also to have another thing that we found is about cancer screening programs, that we want to have a better uptake especially from our BAME population. And that would be another one that we really want to urge, especially to take up on bowel screening programs and cervical screening programs, because those are clear evidence that actually they can prevent catastrophic cancers. And we are still seeing that there's a low uptake from this population, and that's another thing something that we would like to really urge the population of our Muslim population.
Absolutely, very, very important, and I think it goes without saying. And thank you for raising that, because awareness and education is really, really important. And I think people tend to shy away, particularly as you say, from the ethnic minority group, from getting investigated, and the longer they leave it, it doesn't go away. So it's really important that the basic information that you may have. You know, there are professionals out there. You've got your GPs out there. You've got A&E out there. Please don't delay, as Dr. Tan has rightly highlighted. So it's really important, especially for cancer screening. In majority of the cases, when it comes back as negative, but it's always good to rule it out, because the earlier it's detected, the better the prognosis, and it can get better. Though the word cancer is not very nice, but you know, there's a lot of better treatment out there, and individuals can be cured. So that's the most important thing. So it's a really important point. In our final minutes, Dr. Tan, and just want to stay with you, and then I'll go with Leah with the same question. A lot of people have asked the issue around long COVID. So, number one, what is long COVID, and what are the symptoms?
It is. It's not a new type of like a finding as such. Yeah, we have in previously as well. We have any viruses that if you get viral infections, some of the viruses can cause you to have a lingering symptoms for longer than it should be. Like we used to call it like glandular fever before, with the kind of a virus which affects you, and then after that, for a few months, you can feel very tired, lethargic, aches and pains can still stay on. Yeah, we call that as a post-viral syndrome. Yeah, it's similarly COVID now. COVID is also can cause post-viral syndrome, which is long COVID in a way. Yeah, so usually the definition is favorable and across the areas and across the countries as well. But in here, we usually consider if it's after 3 months of getting COVID, you're still like feeling quite tired, lethargic, fatigue has not gone away. Yeah, you're still getting aches and pains. You're still getting like breathing difficulties and in odd ways and things like that, and joint pains, all those odd symptoms, which may show that you might have a lingering long COVID symptoms. Yeah.
And a lingering cough is another one of them, isn't it?
Yes, that's right. Yeah. And so if it's like in that case, then you could just contact your GP, and then they can do the necessary investigation and assessment if required.
Okay, excellent. Thank you. Leah, from yourself, is there anything that you'd like to add to that?
No. So I said to Dr. Tan, I said, if they ask me about long COVID, you're going to answer it. I don't have the answers for it. So,
there you go.
So no, I think I don't have anything to add.
And Dr. Tan has very succinctly put it and articulated what the symptoms are. And you've already touched on, if somebody does, feel that they may have the lingering symptoms beyond 3 months, and 3 months is sort of what you've given. And you said contact the GP. Is there anything else they can do?
Yes, it's again like it is, if you haven't got your fully protected vaccines yet, you should get the vaccinations done. That's quite important. And keeping yourself hydrated is quite important. And doing regular exercises, normal things that will keep you healthy is the way that you will actually tackle this post-viral symptoms, which has been found to be evidence-based in the previously other viruses as well. If you got post-viral symptoms, making sure that you stay healthy and you do exercise regularly and you hydrate yourself, usually like your immune system will win over it. Yeah.
Okay. All right. And that's actually a really good take-home message, I suppose. Yeah. Leah, anything from you? We've got in about 30 seconds. Is there any take-home message from yourself?
In about 30 seconds, I want to say there is spaces for us to get vaccinated. It's out there. We're driving buses around. We're coming into street level. We're calling it hyperlocal. So we'll even go to the street level to just make it really easy for people. We're also going into places where people are housebound. So the capacity is out there. There's clinics out there ready. It's all on the website, NHS website. But also, if people can call, we've got a central booking team. That's also, the number is also on the website, so people can call in and ask questions in terms of where we're having clinics that week. So we're not having clinics 5 days a week, but we're definitely in every space you will find us. That's not far away from where you are in radius.
Excellent. Brilliant. And that's really valuable gold dust information. And I think, it's been really, really good. I want to thank both of you for taking out the time on an evening post-work and giving some very valuable information. And I think, this is one of the purposes, the reasons for the radio show. Thank you very much. And I want to thank to our listeners and say you've been listening to Ramadan FM 87.7, and we'll be talking about